Thank you all so much for joining us today for our weekly COVID-19 update. This time, we're going to spend some time on going over health coverage for everyone in Kentucky, some updated facts from the HCBS waiver document that had came out, and then also education updates. My name is Rhonda with Kentucky Spin. I hope you all are all doing well, and we really appreciate you all joining us today. So what we're going to do here is you'll see on, if you have questions, you can type them in. Again, if I don't see them, or if we're not able to get to them, I do apologize, but I will stop every so often to try to check that and to keep up with that. But again, we'll follow up afterwards, and you can contact us if you have further questions. Also, too, you will see that there are handouts. If you don't have a moment to download those while you're on the webinar, we will also follow up in an email by sending those attached. Just to tell you a little bit about Kentucky Spin, we're Kentucky Special Parent Involvement Network. We're the parent training and information project for the state of Kentucky. Our role is to help you to help your child. We work with individuals with disabilities, parents, family members, and professionals throughout the state. And we don't act as attorneys. We do not represent families. We're here to empower families and individuals with disabilities to advocate on behalf of themselves through a peer support model, which Kentucky Spin, since its conception in 1988, we have all been persons with disabilities or family members of persons with disabilities helping one another, and really to help step through the process. And if we don't know the answers, we will try to connect you with who will. So really a lot of it, everything revolves around in our lives partnership. And the more we partner with one another, the better. It only makes things better for our children, for adults with disabilities, and families. So together is how we are going to best be able to meet all of our needs. So I want to start in the beginning here about the health coverage. And one of the things that the governor has stated over time, the importance of making sure, especially right now, that all Kentuckians have health insurance, health coverage. So this shows you a little bit, and there are more people now, because we are in the COVID-19, the pandemic, can qualify for health coverage where maybe prior to this they might not have. So I just wanted us to take a few minutes to go to kind of over to the website where I can show you all where you go. You go to that main page, and we're going to click over if technology works right for me. So we went to the home screen, the kycovid19.ky.gov. So what you're going to do is you're going to scroll down, and you are going to find where it says, pardon me, I'm trying to get it to go from the beginning. You want to go down to where it says services. Click that plus area, and then it's going to bring this up. What you're going to do from there is you are going to click on the healthcare coverage application, and then it is going to bring up another screen that will step through. It is an easy one-page application that you fill out, and you will be able to submit from there and to print it. Again, this is temporary Medicaid so that we ensure that all Kentuckians have health coverage during the pandemic. So this ends on June the 30th, unless it is extended, but I don't know that it would be. And then you would reapply for regular Medicaid coverage. But it's really important that everybody take time and go and do that. Now, if you are not able to, sorry, I flipped the screen there. If you're not able to do it online, please call the Kentucky Healthcare Customer Service Line. It's important that you're calling the Kentucky Healthcare Customer Service Line at 855-459-6328. And they can assist you with filing for the application and any questions that you may have. So one of the things we just want to make sure that we took a moment to really kind of go to the website and show the process that you do take. It's quick and easy. And anybody that you know that does not have health coverage right now, please encourage them to go on there. It is a quick, easy, one-page application, and it is so critical right now that we make sure everybody has health coverage in Kentucky. So now what we're going to do is go over, we had indicated on last week's update and had shared as an attachment the updated COVID-19 facts for the 1915 CHCBS waivers, the Medicaid waivers that was updated on 4/7/20. So what we wanted to do was sort of pull out some of the questions, additional questions that were asked and answered. The wonderful thing the Department of Medicaid is doing is they are updating this as they get questions and to try to clarify even greater for all of us. So they weren't able to be on here with us this time, but they wanted us, if there's any questions that you have that we can try to help, if we can't answer it here, that to get an answer for you. So their willingness and their partnership has just been wonderful to try to help to make sure that everybody has what they need and the answers that they need as well. So one of the things here is that in the event that there are periods of time when people are asked to stay at home right now because of COVID-19, will the DSP, and that's the direct service provider, or the participant directed service employees, PDS employees, be permitted to provide in-home care to 1915C waiver participants? And the answer is yes. If the employee is emergent, meaning that if they don't have that assistance, they would be in danger of not having their basic needs met. And that is crucial for their not only survival, but their care. So I like to think of it, and I'll use, and I'm sure my brother Grant, and some of you may know, he is on the PDS, and one of the things too is he needs the assistance so that he is able to live independently, but he does require someone to be with him 24 hours a day. So and I know that Grant would want me to share with you all how critical it is, and the wonderful thing making sure during this pandemic that he is able to still have his employees and so that he could still function through this pandemic. Again, he may not be able to go out and do stuff in the community right now, but that's due to for his safety and that of others. We have all been asked, and there's a state of emergency, that we do not go out, and we're staying healthy at home. So, and I'm one for example, so I like to share, probably too much, but in the previous version of the facts, the Department of Medicaid Service said PDS employees and the DSPs would be allowed to provide care to waiver participants if there's a period of time where people are asked to stay home. A participant would be placed in danger of losing functioning that could never be restored in receiving care. Can the DMS clarify what services would be allowed in this instance? So this applies to any personal care or supervision type services necessary for participants' health, safety, and welfare. That is the natural support in home and is unable or unavailable to provide if there isn't someone there who can. So just as I had used, my brother as an example, and other families throughout the state, many of our loved ones require this, and it depends on their care to be able to function and be healthy and safe, and that their welfare be cared for. So the focus is the support participants with activities of daily living, intermediate activities of daily living, and services essential to preserving a person's health, safety, and welfare in his or her home. Again, very specific that it's not out in the community doing things, but it is that they are allowed during this when it has to do with the participants' health, safety, and welfare, so that they are cared for and still able to live independently. This documentation need to be submitted for immediate family members being hired as PDS employee, even though they are receiving automatic approval during the state of emergency. And the answer was yes. Dale, the Department for Aging and Independent Living, created a letter that can be uploaded that grants the temporary approval of the immediate family member as a PDS employee. If you'll remember when we did and had Medicaid on with us, their first rollout version of the facts was that family members could, in an emergency situation, be approved to be PDS employees. And they would still have to have a background check. However, they would be able to start providing services while waiting on the results. And these employees will be approved for 120 days. So they have really planned to try to help to meet the needs of the individuals with disabilities so that they are able to be safe and healthy at home. Can the PDS representative become the PDS employee during the state of emergency? If they do, does a new representative need to be designated? Yes, they can become the PDS employee during the state of emergency. But in this instance, a new PDS representative would need to be appointed, at least in the interim, if they're only doing it to be the PDS employee while the pandemic's going on. Even if it's after, if they continue as the employee, they would still have to have a different PDS representative. So they cannot serve in that same role at the same time. The participant receiving services via the traditional delivery method switch to PDS delivery method to reduce disruption in services caused by the state of emergency. Yes, so typically the Department of Medicaid Services has modified the PDS employee approval process to ease the process for participants during the pandemic. So say if you had originally were on their traditional delivery method and you wanted to switch to the PDS just for while the pandemic's going on, there is a quicker process during the pandemic so that you can get people in place, because you may not be able to get through the traditional way that you had because of the state of emergency and people coming into one another's homes and services being offered. So you do have that, and this is good news for families so that we can make sure that there's not that gap in services and you could switch to it so you can meet the individual's needs who has a disability immediately to sort of speed up that process. So can PDS employees be permitted to work overtime to reduce gaps in services caused by the COVID-19 state of emergency? Yes, during the state of emergency, overtime is allowed for PDS employees providing more than 40 hours of services to a single participant. But here's the key thing. The overtime must be necessary to address health, safety, and welfare of the participant, and should first, before you do it and then submit the time, do you discuss with the case manager, support broker, service advisor who is responsible to document his or her need and update the emergency person-centered service plan. So this is crucial to keep in mind that yes, you can, but it all has to be talked about, and really contacting your support broker and make sure that you get that approval and that okay, and you get an emergency person-centered service plan updated to reflect so. With schools closed, now this is a key one. With schools closed, can PDS employees help with participants' homework? No, because the Department of Medicaid Services does not currently allow PDS employees to help participants with homework, and Medicaid is not intended to deliver educational supports. Case managers who identify this need for school-age participants are encouraged to direct parents or guardians to the participant's teacher or education provider to obtain needed educational supports. So right now, the waiver, depending upon what waiver you're on, but the PDS employees, that's not their responsibility or what's to be provided through the waiver, right? So that has to stay very separated. So you would contact your school and really work with them because of the needed services. If your child is needing those services, you need to contact them, probably request an IEP meeting, conference call, really work with them so that you all can come up with a plan of how to get those needed supports, because of those are educational needs of your child. And that is not the responsibility under the waiver. That is a school would need to identify that and address that. And we'll talk a little bit more here in a little bit about school and really sort of how to access those services, because I do know it is a very hard time. And, you know, we do need, all of us are living in a time we never thought we would. And so there are different supports that we need, but we need to access them through the correct method. And the Medicaid waiver would not be that for the PDS employees. What will Department of Medicaid Service, DMS, accept as an official signature on PDS timesheets during this state of emergency? It stated that it could be signed by hand, email, or text. In the case of the email or text message, a copy of the email or a screenshot of the text message should be saved as documentation. Note that the timesheets are still to be accurately completed and adequately reviewed before signing and attesting to timesheet contents. Again, this goes back related to fraud, waste, and abuse of Medicaid services. So we do still, although there is an alternate means, you can be signed by hand, by email, or by text. But we also do have to ensure too that it is being that there is no fraud taking place, no waste, and that we save the documentation of that and it is being approved by the correct person. Now, the PDS employer's timesheets, can a PDS employer send timesheets without an employee's signature? No, there has to be a signature. Again, it goes back to what was just addressed. It can be in the state of emergency. It can be signed by hand, by email, by text. Again, you need copies of screenshots, copies of the emails that shows that and who approved it. Again, we're trying to eliminate, not that that this would take place, but we do have to prove that there has not been any fraud or waste or abuse of the Medicaid services or the individual with the disability who would be receiving those services. Can a PDS employee who lives in the home with the participant continue to provide services during the state of emergency? Yes, that's the same as it was before. Will PDS employees who are tax exempt be eligible for the stimulus plan Congress is considering? The Coronavirus Aid, Relief, and Economic Security, or CARES, was signed into law March 27, 2020. For questions regarding that, the stimulus payments, you need to go directly to the CARES Act and the IRS about that. So they're not able to answer that through the Department of Medicaid Services. You need to go to the IRS, and there is the website on there to get the answers for that. In the past, PDS employees filing for unemployment had their unemployment adversely affect, pardon me. Oh, that's me and technology. I apologize. PDS employees filing for unemployment had their unemployment adversely affect. This means that some of the participants will not be able to pay employees as much in the future. And what this is you need to contact for questions regarding unemployment. This is kind of just like the stimulus checks. You've got to contact the IRS. You're going to need to contact unemployment to get those answers. And there are all of the contact phone numbers or you can use the unemployment insurance helpline, but you do need to get those answers directly from them. Again, that's not being addressed by the Department of Medicaid Services in this facts for the waiver so far, because that's handled through someone else. So you would need to directly check with the Kentucky Unemployment Office to see if that is going to affect the participants' future pay, that they'll be able to, employees fall under unemployment. So I want to pause just for a moment to see if there are any questions, and I'm going to try to see if technology is not my friend today, so I do apologize greatly. It may be more of the user too. So this could be not a good day for Rhonda. So I apologize for that in advance for you all. So now some important guidance regarding education. And do you all feel like that picture, when I put that on there, I thought, okay, this kind of sums things up where it's like, okay, raise the flag. I need some help. I have come to have, I've always had a great appreciation for teachers, but I even more have a greater appreciation because I'm going to be honest, I'm failing when it comes as a mom helping with NTI. So one thing that we're going to look at here, and I'm sure all of you all, if you joined Governor Beshear's last night at 5, and they did announce, and through the Kentucky Department of Education, that for the remainder of the school year, the Kentucky Department of Education will be closed for in-person classes. So what this means is that we will continue on the non-traditional education program for the remainder of the school year. And it was put into place that the educational continuation plan that allows districts to continue on that program and grants reliefs for them required for the, and what they'll do is they will attend under NTI until they reach the required 1,062 hours of instructional time. And you will have to check with your individual school district to see when that is, or when that would be up, technically what the last school day would be. And they're able to count all NTI days used during the 2019-2020 school year included in that, even if they were used before the current closure, right? So if some of the school districts who normally use NTI outside of a pandemic, a lot of them use it for, and especially in a lot of your rural areas, because for snow days. So those still count, those hours, if they had used any of that prior to the pandemic, and when we all had to switch to the NTI, those hours count in with it. Now, here's some important stuff I just want to kind of go over, and we have shared in different webinars, but I just kind of want to do a recap of everything. I know we've been getting a lot of questions going on and concerns, and again, you know, we're all figuring this out as we go. The federal law IDEA, Individuals with Disabilities Education Act, Section 504 of the Rehabilitation Act, and Title II of ADA, Americans with Disabilities Education Act, and the state law, Kentucky Administrative Regulations, KARA, which includes timelines they set in place. Here's the thing is, the laws did not change, right? So the timelines didn't change, but here's the key. Is those laws, and you're going to see on here where we have documented and given the guidance that has been issued through the U.S. Department of Education so far and the Kentucky Department of Education so far. And those are also included in the handouts. The thing about this is the laws didn't change, but the laws also did not plan and give us any guidance on what you would do in case of a pandemic, right? None of us have ever lived through this before. So although the laws didn't change, we're in a time now under from strict, you know, guidelines of the stay healthy at home, and you know, only supposed to go out to go to the grocery and only be one person from your family, and orders, you know, from the governor and from the president that we are all having to stay home. So there are a lot of things that we have to take into account now, even though the laws didn't change, but the laws did not give us a plan on what we do if this were to occur. So now, initially, because all of us, we didn't really realize it was going to be what it is, but or that we would be on NTI for as long as it is. So initially, not all Kentucky schools were on NTI when this first started. All Kentucky public schools are now participating in the non-traditional instruction program, NTI, and they will be doing so at least through the end of this school year. Now, from the U.S. Department of Education, they identified and addressed that the LEA, which is the local education agency, which is your local, it's your public school district, it'll be your county or independent public school district. If they are providing educational opportunities to the general student population during a school closure, meaning that they are for every student, then the school must ensure that students with disabilities also have equal access to those same opportunities, right? So what it's saying here when it's SEA, the state education agency, which is Kentucky Department of Education, LEAs, which is your local public school district and schools, must ensure that to the greatest extent possible, each student with a disability can be provided special education and related services identified in the student's IEP under IDEA. And also for those who have a 504 plan in school as well. So all schools are on this. So now if you're providing education to all students, you must also ensure that those with disabilities have the same opportunities as others. Also, too, in the commissioner's letter to families, where it addressed the non-traditional instruction program. Again, it said, just like the U.S. Department of Education, that if they use the NTI program, that they must, for the general student population, they must ensure that students with disabilities have the same access and opportunities and have access to a free, appropriate public education, FAPE. Now, although the special education or related services may need to be adjusted some because we're not able to deliver it maybe in the same means, but we still have to ensure that they're getting it. And if you offer it in school packets to students or online learning, you also have to adapt it for the students' needs based on their IEP or 504 plan to ensure the equal access. So those things have to be taken into consideration. The non-traditional instruction program, if you joined us last week, and if you didn't have a moment, we had Dr. Clark on, who helped us a lot with NTI, the non-traditional instruction program. And if you weren't able to join us, we have that recording available. And I love, she stepped us through and really helped us with a lot of the non-traditional instruction program and what that might look like for different students at different levels. Now, it could be given online in packets or in a mixture of that or by other means. But again, it has to be accessible for all students. Now, we get the question a lot. This helped and was identified and clarified in the U.S. Department of Education guidance about the IEP teams are not required to meet in person while schools are closed. But because these are school days, they did state that, because here's what we got to keep in mind is, yes, you should have an annual IEP meeting. That's one of the timelines in it, in IDEA and the state law. And what you have to do is you have to address those different needs and concerns. But we're going to have to look at alternate means. Can we have the IEP meeting but have it via video conference call? Or because I do know there's annual reviews. So you may not be able, if you can't be face-to-face and you all aren't in agreement to all meet by alternate means, then once school goes back and reopens traditionally, then you would have your IEP meeting. But one can be called at any time, even if it's not your annual review, and you would use alternate means to address, to be able to access that. Now, there's also a question we've been receiving a lot about is the evaluation. So the evaluation process, because it's 60 school days in Kentucky, the evaluation has to be completed by, from the time the parent signs a parental consent to evaluate. Here's the issue there is, if the evaluation requires face-to-face assessment or observation, we can't do that right now, right? So we're under orders that, you know, for the safety of our children, our families, our teachers and their families, we can't do that. Now, if it's an assessment that can be done that doesn't require that face-to-face or that observation, then yes, continue and go ahead and do that. So we're really got to work together to sort of meet these needs given what we have to do right now. And look and think, you know, my whole life has been trying to think outside of the box, right? So we've got to do that even more so now. And how can we still meet the needs and help our children, but still, you know, there are some things we may not be able to do till we go back. Now, on here, also from the U.S. Department of Education, is the compliance with IDEA and 504. The reason this came out in the guidance, because what was happening, and this was throughout the United States, and not so much here, but in Kentucky, but people were afraid to offer the instruction in an alternate way because they were afraid that they would be at risk of not providing FAPE, so for children with disabilities. So that should not prevent anyone from offering educational programs through distance instruction. And the U.S. Department of Education identified that, yes, we should not let it stop it, but we've got to make sure that it is accessible and for all students. But it is very key that we continue, even if it's distance instruction, for all of our children to be educated. So one of the things too that I want to make sure that we point out here is the Department of Education also understands that this is a national emergency and we can't provide things, whether it be as a parent or as a school or all of us working together in the same manner that we may have done before, right? But we've got to look at how can we do it with what we've got, and how can it may not be at the level we had hoped, but really working together to be able to provide those services and how we can adapt to it so that it is feasible and safe for everyone involved. And it also identified therapies. If it was therapies related, related services on your child's IEP that can be provided that is not hands-on, right? They don't have to be right there in person, then those things can continue. So it's going to be key of really looking at, and also too, it may be altered a little. Maybe some things that they could help you to be able to work with your child at home. So there still is some level of that being provided. It may not be to the same extent that it would have been if we were in person, but think of different ways that maybe they could help you or show you different things, or they could provide the therapy if it's appropriate through video conferencing. Now, we've got to make sure too that if the distance learning is online instruction, the videos have to have captioning, embedded sign language, accessible reading materials, speech or language services through video conferencing. Everything has to be accessible for all students. And also, the work that is given also needs to follow and be adapted based on what is in your child's IEP or 504 plan. Now, it also, in that same guidance document, identified the instruction again, be accessible, barrier-free. The thing is if the teacher, an example would be if a teacher who has a student who is blind in her class cannot distribute a document accessible to that student, she can distribute to the class an inaccessible document, and if appropriate, read the document over the phone to the student who is blind, right? So all of her students are getting the same material. She is offering it in an altered way. Is she'll read it, or if there is a book on tape, well, we used to call it book on tape when my brother was little, but we're quite a bit older now. But it, as long as that same book is either read or provided, if you cannot provide it in an accessible online form, you are still providing that accessibly to them through an audio recording of the document, or you are reading it to them. So yes, it may be provided to a student with an IEP or 504 plan in a different way, but it's the same stuff, but being provided and accommodating and is appropriate for each individual student's needs. And that's going to be the key. Look at any opportunities where teletherapy, teleintervention can be used, meetings being held, tracking data, documentation. And there is and has been addressed that, you know, it was stated in the U.S. and the Kentucky Department of Education, we're going to have to look at when children come out of this, when everything goes back to normal, children who have IEPs, the schools, each IEP team is going to have to look at, is compensatory education needed? Now, there has not been a lot of guidance on a lot of things. We're not sure exactly what that's going to look like or how things are going to play out. I do know that from last week, on a call with the U.S. Department of Education, they did express that there would be more guidance that comes out regarding, it could be regarding IDEA, 504 guidance. We're not sure on the exact topics that are going to be addressed, but we will keep you updated and make sure, and I will show you here in just a little bit how you can go and keep up to date on our website where we post all of the latest information that's been shared. So we do anticipate there being more guidance from the U.S. Department of Education, but none of us are sure what that guidance is going to explain yet. All of us are having to figure this out together and as we go. And again, that's key to the partnership and us all working together. So I have had a question, and what was raised too. NTI is not an IEP placement change. NTI is a location change for all students, right? So it's not a placement change. So it just, the way that it's being delivered is altered for all students, right? Also too, some of the questions that I have been given is that should we have, because people felt that it was a placement change, should there be the IEP meeting to address that? Well, it wasn't a placement change, so there would not need to be an IEP meeting held for a placement change, because that's not what it was. It was a location change for all students involved. And so, but it's important to call an IEP meeting to come up with a plan with the IEP team of how you all can all work together, concerns that you're having, things that you're seeing. We've all kind of been on this NTI for a while. Now might be a good time, you know, keeping that constant contact with your teacher and maybe coming up with a plan. If you've been trying different things and it's not working, please share that with them. And maybe you all can come up with some new methods or new ideas that you all can share. So through this, we will accomplish great things for our children. Although none of us ever pictured that we would be here, you know, it's still, it isn't going to look like every other child's. But again, we work together so that we can make sure that our children are getting the best, most appropriate education possible, given the pandemic that we're all living through. I do want to stop here for a moment to see if there are any questions, and I don't know if it's me or the technology. So if I'm not seeing questions right, because I have a hard time with the grid over here. So I will, if I'm not, if you all can please email us and follow up and let us know if there's some questions that you have that we could kind of go over. I did want to also show you in the PDF, the attachment, and it is one of the handouts, but these are all clickable links that you can click within that to be able to access that. There's a great Office of Civil Rights, OCR, webinar on online education and website accessibility that is a very good short video that really gets at ensuring that all children have equal access. Now, what I would like to do before we do this is sort of switch over, and I will show you real quick where you can keep up with some of our if you go to our main SPIN website, which is kyspin.com, and you click on right here, the COVID-19 page, we are keeping all of our webinars. There's a message from all of us to you all. You can download all of our upcoming webinars right here, and we are actually working to update more of those, and we will make sure that it is linked on there. So we've got a lot of great webinars. This Thursday coming up is our behavior strategies webinar. Please go register for that. If you're not able to join, we are working very hard to get things turned around very quickly and getting them on our YouTube channel and on our website, making sure that they are accurately closed captioned so that it's accessible for all. And we are turning them around in lightning speed because we do know that this information is what you need immediately. So you'll see that Kentucky Spin webinars and videos, there was the NTI one that we did last week you can access, and others that you may find helpful. After we get off of here later this afternoon, I'll be uploading our webinar we did last week, the special education process recording. You can access that as well. Now, important guidance to stay up to date for educating all children, and specifically children with disabilities. Guidance that's been issued, you can go, and these are, the top is the most current, which the Kentucky Department of Education had tweeted at 6:21 p.m. yesterday about that schools would be closed in person, but they would be on the NTI through the remainder of the year. You can access all of that information right there, and we're keeping all of this on one page that you go to for ease of access. Then there will be some additional information and resources where you would find information about the Medicaid waivers updates and all of that we keep right here. So I just wanted to make sure you all knew about that. And something very crucial is, making sure that we all stay in contact with one another. And if there's any topics that you are finding that would be very helpful for you as we step through this, please let us know your ideas that you might have, because we're going to continue these weekly updates for as long as needs to be. We're scheduled through April, and we actually have got to update it, but we are scheduled through May as well. So we are going to be hanging right in there with you all. I can't believe we might actually finish a little bit earlier today, but I want to make sure that you have the most accurate and most up-to-date information. I'm going to try to see if I can see if there's questions, but again, I may be missing them, and I'm just going to be really honest with you. So if you could please email me those, and I will give you. So I already explained that we're going to have the webinars, and then again, we're having other webinars. But if you would like to, you can email us here. Here's our email address. If you could send those questions to us, I'd greatly appreciate it. And so we will please join us if you're able to for our session on Thursday at 11 a.m. Eastern Standard Time for behavior strategies. And we will keep you all updated. And thank you so much for joining us today. Stay safe and have a great day.